Well, it's been a year for all of us, and it's time to reflect on where we've been and where we're going. And it's surely obvious that it's taken all of us as individuals and as teams working together and as a hospital system pulling all of our resources together as we battled COVID-19.
When COVID-19 started, it was a lot of unknown. We've come together as a team. We didn't know what to expect. We didn't know what kind of things we would see from a respiratory standpoint, and sometimes patients were vastly different in their respiratory process. Watching some of these patients has been also very hard because they can't have visitors, they can't have family in there, and so we become their family. I wouldn't change it for the world. I wouldn't change what I do. It's hard. Sometimes it's us and an ICU nurse, and we're the last people in there when a patient passes away.
We started early on putting an incident command in place, and we would meet on a regular basis to look at what were our supplies. We looked very carefully at what was going to be needed to take care of these patients, and early on it looked like it was primarily a respiratory illness, and that we needed to make sure that our respiratory therapy department was appropriately staffed, as well as that we had enough ventilators and that type of thing.
And speaking of incident command, I'm not certain how many consecutive weeks our incident command structure has been in play. I suspect Scott Draper might know that. But what a team effort. It was really remarkable to be on the incident command team and understand how we can make these complex decisions in a rapid manner, involve all the parties that needed to be involved in making those decisions, determine priorities, and then implement the decisions.
After we started on developing the incident command system here at Unity Point Health in Des Moines, we also got together our providers, our key leadership within our providers, our anesthesiologists, our surgeons, infectious disease, respiratory therapy, nursing, to look at what our response was going to be and what their staffing levels were. So not only did we need equipment, but we needed staffing.
A special call out, though, I think is needed for our hospitalists, our respiratory therapists, our critical care providers, and the critical care and Yonkers 7 and 8 nursing teams. They are the front line. They really, each day, stepped up and stepped out and took care of patients. And that team has taken care of the highest number of COVID-19 inpatients anywhere in the state of Iowa.
Just sitting with them and holding their hand when they get scared. You know, these patients are very lonely. There's FaceTime and they can call their families in and things like that, but they're alone and they're sick and they just don't get better, some of them. And some do and go home, which is great. We're very happy about that. But others that you become close to do get worse and pass away. And it's difficult to see.
One of the aspects of our response that I'd like to call out is the flexibility of our team members. They showed up to the challenge, they stepped up, and they provided care without hesitation, even when there were unknowns, because after all, we had a lot to learn about the virus and we're still learning. So that flexibility and adaptability of our team members was so important and continues to be important.
I feel for these patients because they don't have family members that are allowed to be here and be their support. So when I am working with my patient who has COVID, I try to be that extra person to let them know that we're here for them and we're going to keep them safe and we're going to help them.
You know, it's true that all of our clinicians played a key role, from our primary care physicians in clinics to the OR and everybody in between. Everybody had to make rapid adjustments so that we could provide safe patient care, so rapid adjustments in their workflows. And everybody had to find a way to keep up with the rapidly expanding knowledge base about COVID. All of that was really critical to patient care.
Our respiratory therapy department, in conjunction with our critical care doctors, have found out that using something like high-flow oxygen, which was not what was being used around the United States, but using high-flow oxygen, we could help to prevent people going on the ventilators. They did better. Mortality, morbidity, all those things were better when we did not put people on the ventilators. As a result, we really became a model for the rest of the United States and the medical systems on the use of high flow in COVID, which greatly relieved our necessary dependence on ventilators.
So there's some other healthcare heroes we should call out that are not quite as obvious as the frontline staff, but played a really critical role. Really, so many, but in particular, let me address the laboratorians, the EPIC and informatics support teams, and employee health. Think about the laboratory challenge. They had to take on new tests in a very short time frame. They had to deal with a very large volume of tests requested and manage reagents that were allocated and always in short supply, at least early on. I believe that the laboratory received their first COVID-19 reagent on March 26th of 2020, and on March 27th of 2020, they provided their first patient result. That's incredible, particularly when you realize that the standard length of time for providing a new test is somewhere between 2 to 6 months for a laboratory to provide the validation and test reporting that's required. So kudos to the laboratory staff for being able to so rapidly provide the needs so that we could take care of our patients.
We're tired. We've done this for a long time. We've provided quality care to each and every patient that's come through our doors since March. But the more and more COVID patients that we see, the more of a strain it puts on the hospital and it puts on the staff.
We noted early on that we needed to be able to work in our communities with our community resources, in particular our EMS systems, our emergency management systems. We worked very carefully with the Polk County Emergency Management here at Unity Point Health Des Moines in order to have a county-wide response, whether that was on personal protective equipment, on how and to transport patients within our EMS systems, to ultimately on distribution of vaccine when vaccine became available. This was a very critical part of our response to COVID, and as a result, I believe our communities benefited greatly from our coordinated response.
Just knowing that I'm here helping to give them comfort, to give them joy, to give them laughter and love, because a lot of times we don't have that right now, and they miss their families. We're touching lives here, and this is my blessing, this is my calling.
What I am most amazed about is the bravery of our staff, the bravery of our nursing staff, our housekeeping, of our medical staff, of everyone to come into work every day and take up all the new challenges that day provided, and to provide great care in a very scary situation. I've never seen anything like that before. I've never seen people work that well together. And as a result, I think we got great results and a great response to our community. We benefited all of us benefited from that bravery, from that professionalism, and that willingness to work together.
So I do like to reflect on the bright spots and what we'll keep going forward, like how we all had each other's backs. I felt it. At least on more than one occasion, Dr. Pirtle claimed he had my back, and I know that he did. And all of Unity Point Health Des Moines had each other's backs as we worked through the process of providing care in this complex setting. In addition, as we worked together, we more deeply understood each other's role in this setting of providing patient care. And with that, we were able to understand the ripple effect of decisions. And all of this is with the common purpose of providing the best outcome for every patient.
I think I heard somebody say a few weeks ago that like they're hitting the pandemic wall, and I think everything kind of coming to a head with having some of the hope with vaccinations and that kind of thing. Hopefully we have an end in sight, but probably not soon enough for everyone's mental health.
I am very pleased to be a co-chair of the Westerberg celebration this year in 2021, because I think the intent of where these funds will go is very important. We have had a very intense time for our staff over the past year. As we come out of all of this stress, I anticipate that there will be needs that will become apparent at that point, and I think these funds can be used to help support them during that post-stress period of time.
And now our focus broadens a bit. The support from tonight will provide us the resources we need to respond to the needs of our team members with as much speed and nimbleness as we did in providing to the care of our patients. And I'm really honored to be a part of this.